right, so today I'm going to be inserting an NG tube into my patient. I received my physician's orders, so I've reviewed those, collecting my supplies. And while doing that, I'm going to check the expiration dates on everything. Okay. Looks like everything is within date. So I am going to head to my patient's room. Good afternoon, Mr. Smith. How are you?
Good, how are you?
Good, I'm back again. I am here to do a procedure today. The doctor has ordered for you to get an NG tube inserted.
Okay.
So I'll be here for a little bit.
Great.
Let me just get things prepped in the room. Okay, let me get you some here. Okay, our lighting looks good. And I am just going to wipe off the bedside table with my cavi wipes. Do you mind if I set the supplies on your bed while I do that?
No, I don't. That's okay.
Okay, just for a second. Okay. Change these gloves out. Right. I know I've been in here 1,000 times, sir, but would you please confirm your name and date of birth for me?
Yes, my name is James Smith and my date of birth is 3/5/1957.
Perfect. And sir, do you have any known allergies?
No, I don't.
Okay, great. Thank you for that. I know it gets a little redundant after a while.
It's okay.
Just gonna raise your bed up here. Okay. Okay. I'm just going to be using my pen light to check inside your nasal cavity. Okay. Do you have any history of nosebleeds?
No, I don't.
What about any injury to your nose, deviated septum, anything like that?
No, not that I know of.
All right, great. Well, good. Then with that being said, I think it's time we can start with this procedure. I'm going to have to raise your bed up. I'm going to have to put it all the way up to about 90-degree angle, okay?
Okay, sounds good.
Okay. You still comfortable?
Yes, I am.
Perfect.
Thank you for asking.
Okay. So I'm going to start by just checking a few things out. I'm going to be checking your nasal passageway into your mouth, and I'll be listening to your abdomen, and then we're going to start the procedure. And pretty simple. I'm just going to be inserting a tube into your nose, down through your esophagus into your stomach. Help alleviate some of that pressure you have by emptying and suctioning out some of the contents.
Okay.
Do you have any questions?
No, I don't.
Okay, well, let's start with, if you can just blow your nose for me. And I'm gonna press on the right side here and blow in with your left. Then we'll do the opposite side. Okay, great, thank you.
But last night it was doing something weird. It was like acting like.
All right, it looks clear. I don't see any obstructions on either side. No deviated septum, so I think I'm going to enter on through your right nostril if that's okay.
Okay, sounds good.
Before we do this procedure, I also have to test your gag reflex. So I'm going to be sticking this in your mouth.
Okay.
And just to check. All right, sorry about that. I know that makes you gag when I stick that back there, but that's
That's
how we know
okay.
that we can do this procedure. And do you mind if I just pull up your gown so I can listen to your abdomen?
Yeah, no problem.
Hey, we're gonna go on a trip to Colorado if anybody wants to join. To 50 different people. I don't know. That seems like,
Okay, I'll be starting at the
yeah, like over like a break or whatever.
lower right,
Like 1 weekend of being here.
upper right, upper left,
There were people that were like, yeah, let's do it. I was like,
lower left.
I started the wrong group.
Okay. All right, everything sounds good.
Great.
Still comfortable?
Yes, I am.
Great. Okay, and I'm just going to drape this over here for you. Now, while I do this procedure, if you can just keep your head up against the pillow for me, please.
Okay, I will.
Again, if you have any pain at any point, please let me know, okay?
I will.
It's embarrassing.
All right. And before we get started, I just want to check cognition. Can you tell me what day of the week it is?
Yes. Today is Thursday.
Today is Thursday. It is indeed. Do you know what you're here for?
Yes. I'm here because I'm sick.
Okay. That sounds about right. And what month is it, Mr. Smith?
It's February.
All right, perfect. Well, great. Well, it sounds like we are ready to go. Please, if at any point you have any questions or you feel any pain, let me know. While I'm putting it down, it may be a little uncomfortable, so if you could just raise your hand if it starts to give you any kind of discomfort, okay?
Okay, I will.
And we'll
Thank
stop.
you.
You're very welcome. Okay, so I'm going to be measuring from the tip of your nose, back here, behind the ear, and then coming down here to your xiphoid, right like by the breastbone. And I'm measuring at 58.
Okay.
All right, so I'm going to put a piece of tape there. Mark this so I know that that's as far as I need to go. 6758. Okay. Alright, and I'm going to wind it around my fingers so I can loosen it up a little bit. That way it goes in a little bit easier.
Okay.
And I'm going to spray lubricant on the first 3 to 4 inches or so to help it get in there a little bit easier.
Yeah, I have it all, but it's like I just can't submit it.
All right, Mr. Smith, and like I said before, we're going to enter through your right nostril.
Okay.
I'm going to start this now. Like I said, please just raise your hand if you feel any discomfort, okay?
I will.
Okay. Okay, as I get it in there a little bit, I'm going to check in your oral pharynx area. Make sure that we're not obstructed and we're going in the right direction. And I'm able to see the tube, so that tells me we can keep going. Now to make this easier on you, sir, if you can take a sip, and I will continue to get this tube progressing downward as you're taking sips of water. Take another sip for me. Thank you. Doing a great job. You feeling okay still?
Yes, I'm feeling fine.
Great. We're almost there. Okay. And ideally, I would be at the end of my tape now. These mannequins, it's a little bit harder. We're almost there. Okay. Well, I think we're gonna be able to make it. Okay, great. We are at the edge of the tape. Still feeling okay?
Yep, I'm feeling great. Thank you for asking.
Okay. At this point, I'm gonna get a piece of tape here. And I'm just gonna put a piece of tape on your cheek here. I won't leave it like that, but if we can do that just for a moment, okay?
Okay, sounds
All
good.
right, thank you, sir. Okay. So now, in order to make sure that we do have this in your stomach, I'm going to withdraw 5 ml gastric liquid.
Great.
My valve on here.
It looks so bad. Like it just looks dirty.
Okay. All right, we have 5 mLs.
Great.
So let me test this. Same one right here. Grab my litmus paper here. Okay. I'm just going to test a small amount. Here. Okay, so based on the coloring, we're at about a 2, and I know it needs to be between a 1 and a 4 for the acidity of stomach content. So that means we are in the right place. So that's good.
Yay.
Yes. You having any discomfort?
No, I don't.
Okay.
Thank you for asking.
It sounds like you're able to communicate well too, so that's good. So at this point, sir, what I'm going to do is we are going to send you down to X-ray just to double check, make sure everything is in the right place.
Okay.
I'm going to go ahead and secure this so it stays on a little bit better.
Thank you.
You are very welcome. Gotta love this tape. Okay. Just gonna put that around your nose. And just attach it here so that tube will stay in better.
Great, thank you.
Okay, you're welcome. I'll get rid of this. And if you don't mind, I'm gonna tape a piece on your chest there as well.
Okay.
All right. Okay, so I'm gonna send you down to X-ray, and as soon as you get back, we will check things out again, okay?
Okay, thank you.
I'm just gonna lower this card handrail back up, and you're good to go. So he has gone to X-ray. I'm gonna change my gloves out, clean up my area. He's back from X-ray. Welcome back, Mr. Smith. How you doing?
I'm doing fine. How are
Good.
you?
Good. Everything went well?
Yes.
Okay, let me take a peek at these X-rays. Okay, good. Everything looks good. Looks like we're in the right place, so that's good. I'm going to listen to your abdomen one more time.
Okay.
Okay. Okay, let me just pull up your gown again. Okay. Don't feel any distension. Does that hurt at all when I press on it?
No, it doesn't hurt.
Good, good. All right, let's put this back up. All right. Well, I think you are all set. The biggest thing, sir, is I am going to lower your bed, but I can't put the head back any more than 30 degrees, so you have to keep it at least raised up that much, okay?
Mm-hmm.
But before that, let me actually do the suction. Okay. And the order is to do the suction at low, intermittent, I'm sorry. Let's take that off. This connects here. Okay. Right, turn this on intermittent. So it's on intermittent. Okay, and it looks like the dial is within the low range, the green there, so we're all set.
Yep. Sounds good.
Okay, good. Still feeling okay with that going?
Yeah, I'm okay.
Perfect. All right, so well, I'm gonna lower your bed.
You paid for that. You should probably get one.
Okay, and I will put your head down as much as I can. Like I said, we just can't go past 30 degrees.
Although, like, yeah, like my space.
Okay. You comfortable like that?
Yes, I am. Thank
Okay.
you.
All right, well, I'm gonna leave your call light here for you.
Okay.
Is there anything else I can get for you right now?
No, I'm okay.
I will be back in to check on you a little bit later. Get all of my supplies out of here, and I will be documenting what we did today.
Okay, great.
Yeah, you know, accidents, but like also not. And I'm really excited.
Now I will be and leaving the patient's room.
Okay, great.